Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Methods of creating the pneumoperitoneum. Pneumoperitoneum. So this includes, there is a closed method as well as open method. So closed means it uses a varus needle with a safety valve at the tip to reduce the risk of the bowel injury. So this includes a safety valve at the tip to reduce the risk of the bowel injury. Next is open. Open it utilizes the Hassan cannula. This is nothing but the Hassan. So Hassan cannula is used and under the direct vision of to decrease the risk of vessel injury. To decrease the risk of the vessel injury. So next is there is a trocar. A trocar is placed at or just below the umbilicus. So then comes the trocar. So this trocar, if you see, it is placed at or just below the umbilicus. So it can be below the umbilicus or it may also be present is placed at or below the umbilicus and penetrating the various layers. So it penetrates various layers. So the carbon dioxide is the most commonly used and preferred gas for the pneumoperitoneum. So it is a CO2, there is a carbon dioxide which is most commonly used. Next is the flow of carbon dioxide is for creating the flow of the carbon dioxide is for creating the pneumoperitoneum, and this is nothing but at 1 liter per minute. Next is IAP, that is nothing but the intra-abdominal pressure. It should be used for maintaining between the 12 to 15 mmHg. Now let's look at some complications of the laparoscopy. So complications here is that there can be shoulder pain. So what do you mean by shoulder pain? Shoulder pain, it is caused by the carbon dioxide retention. So the CO2 retention which is seen, and there is irritation of the diaphragm. So there is irritation of the diaphragm. Next, so when we saw the complications, it can lead to the shoulder. So it is referred to the shoulder via the phrenic nerve. So these are the complications. So caused by carbon dioxide retention and irritating the diaphragm, and referred pain to the shoulder via the phrenic nerve. Then moving on to the gas embolism, there can be gas embolism. So gas embolism, it can occur due to the induction of the pneumoperitoneum and with the insufflation of the gas directly into the open vein. So insufflation of the gas directly into the open vein, and often it is the carbon dioxide. Next is the CO2 embolism. So CO2 embolism, this is the initial rise in the end-tidal CO2, initial rise of the end-tidal CO2, and this is due to the pulmonary excretion of the absorbed CO2, followed by a sudden decrease in the fall of cardiac output. So there's a pulmonary excretion of the absorbed CO2 followed by a sudden decrease in the fall of the cardiac output. Next, we move on to the gases used in causing the pneumoperitoneum. So what are the gases which are used in creating the pneumoperitoneum? So the preferred gas, it includes the carbon dioxide as well as the N2O. To learn and grow daily like this, please do subscribe.